Hi, Dr. Gulani. I'll explain to you what nearsightedness is. Nearsightedness, its technical words is myopia, and how we can correct that with modern technology and techniques. So first of all, what is nearsightedness? When your cornea, the front clear window of your eye, is more steeper than normal, more curved. So with a laser, using LaZrPlastique techniques that I've developed without cutting or chopping, with numbing drops within minutes, we can make it into a perfect dome like a basketball and correct your nearsightedness. Depending on your thickness, we can do techniques from cutting flap techniques like Lasik, etc., or non-cutting techniques like LaZrPlastique and others that you will see on my website. Within minutes, that can be corrected. Now, let's say you're extremely nearsighted, okay, and still very young, you don't have a cataract, meaning your lens is nice and clear. So I still want to focus on the front of your eye to get you to see. So in those cases, I use what is called an ICL or a phakic implant. Phakic meaning, phakos is your lens, your natural lens. Phakic implant is a lens I put in on your lens. And again, you don't feel the pain, you don't feel it at all. It takes minutes to do under drops. So I would put a special lens on your lens and it stays there forever. And that lens helps you with extreme nearsightedness when, let's say, your cornea is so thin that it cannot be lasered. Let me add to that. As you know me, I always like different techniques, staging, combination, as I like to get straight to the end zone. I can still do laser in addition for any residual nearsightedness or astigmatism. All right? So you can have that combination too. So ICL, LaZrPlastique. Now, let's say you're of the cataract age group, meaning you're over 55, 60, and the lens has become cloudy. Now, this cloudy lens, of course, is one of the culprits. So you can't just leave it inside and do LaZrPlastique or ICL, right? That'd be incorrect. I would then go after the cataract and put a new generation lens implants in its place, which not only give you clarity, but also correct your vision. They have the prescription to correct your nearsightedness. Newer technologies today not only can correct nearsightedness, it also has what we call a toric lens, which can correct your astigmatism while it's there. Many nearsighted people have astigmatism. Also, it can correct your reading, because some of them can be, with the new technologies that we're involved in, could also be multifocal. Remember, progressive, multifocal, bifocal, trifocal, and stay around forever. So we can correct all that. Additionally, again, if there's any residual error, or if there's so extreme, I can add to this by doing LaZrPlastique on the cornea, and again get you to excellent vision. So nearsighted patients can be helped. They are more prone to retinal detachment because their eyeball is much longer in the back than normal people, but that's why you're always under surveillance with your retina specialist. We make sure all those things are taken care of. Not so much in mild and moderate, but obviously in severe nearsighted patients. So don't ever let anyone tell you you're too nearsighted or it can't be corrected. Even if you've had previous Lasik, cataract, radial keratotomy surgeries, I can still correct that with LaZrPlastique. So if you're nearsighted, you can be helped. And delve into our website. There's so much information I've gathered for you. Get into it. Send us your questions. Me and my amazing staff in Jacksonville, Florida, look forward to seeing you. Dr. Gulani.